Hello, everyone. My name is Ivy Liu. I'm one of the registered dietitian at the Toronto Western Hospital Bariatric Surgery Program. Welcome to the 1-month post-surgery class. The purpose of this presentation is to review some relevant topics at this stage post-surgery and to hopefully answer some common questions you may have. There are several modules for this class. We will start with the nutrition component. There will be a nursing component that will be covered later on. Here is the class outline. We'll be covering eating techniques, protein, diet progression, and vitamin mineral supplements. To start off, we shall review what eating techniques are and why they are important. The eating techniques are cutting food into small pieces to have small bites. Chew food really well. You may want to chew 20 to 30 times before swallowing, or chew until the food is in a puree texture in your mouth before swallowing. Take your time with eating and eat slowly and mindfully. Make sure to separate eating and drinking by 30 minutes, and to stop eating when you feel full. When these eating techniques are not followed, you may experience pain and discomfort, which many describe as coming from the chest rather than stomach. It may feel like a stabbing pain or tightness that sometimes radiate around to the back. This may mean that food is stuck in the opening between the stomach pouch and the small intestine. This happens when food haven't been chewed enough and is not a smooth enough texture to pass through, or when the stomach is overwhelmed with too much food at one time. It may cramp up and sometimes cause food to come up. You may vomit or have the foamies, which is a mucosy foamy substance that comes up before the actual food does. Please do understand that it will not be realistic to change eating techniques overnight, so expect some of these things to happen and don't be hard on yourself if it does. Instead, take it as a learning opportunity moving forward. For some people, when they get the feeling of food being stuck, patting their chest like you're burping a baby can help move the food along. Some people find it helpful to change their position, going from lying down to sitting up or from sitting up to standing up, which can help move the food along. Another strategy is to walk around. Some movement can potentially help the food move along. I will caution against drinking to try to flush the food through. This can actually make things worse and cause more pain and pressure to build up, leading to vomiting. So please resist the urge to drink and wait for the food to pass. There are many nutrition complications that could happen after surgery. We won't be going into each one, only some of the common ones at this stage post-surgery. All this information can be found in your nutrition manual, so please refer to that. If you cannot find your copy of the nutrition manual, you can download a copy from our website at TWH Bariatric Clinic under the Health Information tab. It is titled Eating for Health Before and After Bariatric Surgery. It can be very difficult to get enough fluids in the early month post-surgery, so you need to be very diligent and always have fluids with you and be constantly sipping on it in between meals and snacks. Make sure it is very small sips. If you're having a lot of trouble meeting your fluid needs of 6 to 8 cups a day, you can modify one of the eating technique rules that asks you to wait 30 minutes between eating and drinking, if necessary. This can be altered to wait only 5 to 10 minutes before eating, but you will still want to wait the full 30 minutes after eating. This is important to minimize discomfort now and to avoid getting into the long-term habit of eating and drinking at the same time, which can flush the food through the stomach, cause you to be hungry sooner, and contribute to grazing and potentially weight regain. It is not abnormal. Plain water is not sitting well in your stomach. A lot of patients describe this as water sitting heavy in the stomach or feeling hard on the stomach. When this happens, here are a few things you can try. Try changing the temperature of the water. Some people find they can only have ice cold water. Others find it has to be warm or even hot. Some people find to tolerate water better by having something dissolved in it, which can be meal or crystallized drops or sugar-free Kool-Aid powder or even a squeeze of lemon or lime or splash of fruit juice. Please remember that sugar-free popsicle, sugar-free jello, soups, protein shakes, decaf coffee, herbal tea all count towards your fluids, and you can use these to help you meet your fluid goal. At this stage, if you're not up to 6 to 8 cups of fluids a day, we don't recommend having caffeinated beverages as they pose a small increased risk of dehydration. And you do not want that increased risk at a stage where you're already vulnerable to dehydration. So choose herbal tea or decaf coffee instead until you can get 6 to 8 cups of non-caffeinated beverages a day. Here are some signs of dehydration to watch out for: dry mouth, dry skin, dry eyes, feeling thirsty, not urinating very often, or having dark urine. If you find no matter what you try, fluids are hurting your stomach and that over time you're getting less fluid in rather than more, then please reach out to the bariatric clinic so we could help. The next common nutrition complication at this stage is constipation. In the early month, it's hard to get enough fiber in your diet. This is because you are on a modified texture diet, including the liquid diet and the puree diet, and the volume of food you're eating is very small, so it is difficult to include enough fiber and you may get constipated. You can try to include high fiber foods as soon as you can on the soft food diet. At this stage, you can start incorporating high fiber cereals such as bran-based cereal, which can offer a lot of fiber in a small volume. You can incorporate it into a yogurt parfait mixed in with granola. Another item that is high fiber and high protein is beans, lentils, legumes. They are usually well digested on the soft food diet, so include them as much as you can. Once your fluids and fiber consumption increase, you will hopefully be able to have regular bowel movements without any medications. It is also important not to underestimate the need for movement. Going for walks after the meal or moving around the house can help stimulate the bowel and help you to have more regular bowel movements. Keep in mind that it's very normal to have fewer bowel movements at this time because you're taking in so much less food. Having fewer bowel movement doesn't necessarily mean you're constipated. A true constipation would be when the stool is dry, painful, and difficult to pass, and that is what we want to avoid. You may still be taking the Senecot that was recommended by the nurse navigator before you left the hospital, or you may have received instructions about using the occasional laxative or suppository. You can use those, but the goal would be to gradually wean off of any type of constipation medication so that your bowels don't become lazy over time. Hair loss can be distressing. It is usually short-term unless vitamins, minerals, and protein are low in the long term. In the short term, it is usually a response to a rapid weight loss, shock of surgery, changes in hormones, etc. This is usually most apparent 4 to 9 months after surgery and slows once people get closer to their goal weight or maintenance weight. Once weight loss slows, hair can start to grow back. Please don't get different supplements, shampoos, essential oils, etc. that claim to help with hair growth or prevent hair loss. They most likely will not work for you because your hair loss is very different compared to the hair loss that those products are trying to treat. Some products can even be harmful. For instance, biotin is often one of the supplements promoted for hair loss, but it can throw off blood values such as heart attack indicators, thyroid blood tests, so we recommend not taking biotin for hair loss. Many people here have thyroid concerns and thyroid treatment will change based on blood values. Therefore, if blood values are inaccurate, treatment and medication dose may not truly be appropriate, thus worsening thyroid condition and worsening hair loss, as hypothyroidism or low thyroid can also cause hair loss. So please avoid the products promoted for hair loss on the market and stick to a vitamin regimen. Most common cause of hair loss post-bariatric surgery is iron deficiency, which is why we have the specific parameters for how much iron should be in your multivitamin. The last nutrition complication we're going to briefly touch on is lack of appetite. This is very common. You may find yourself having no desire to eat, finding that eating has become very mechanical. You're eating because you have to. This is very common. On the other hand, it is also very common to have an appetite post-surgery. We see both sides of the spectrum post-surgery. Over time, the spectrum will close. People who lack appetite post-surgery will gradually find their appetite coming back, but not to the extent it was pre-surgery, which can be beneficial in preventing overeating. For folks who already have an appetite, understand it can be a bit scary to want to eat already, but it is in fact a positive thing because it's going to keep you motivated to eat at regular intervals throughout the day and to eat a variety of food for nourishment. Getting enough nutrition is very important to help you lose weight effectively. This is the end of this module. I shall see you in the next one.